Good day, everyone. My name is Felix Emmanuel. We are here to talk about the Mongolian health situation and liver problems among Mongolian population. This presentation was made by Joven, Mission Group, Ishan, and Felix. Mongolia is a country situated in East Asia with a population of 3.2 million people. Approximately one-third of the population resides in rural areas, maintaining a traditional semi-nomadic lifestyle. It is known as a lower middle income country, relying on mining and agriculture for its economy. The healthcare system in Mongolia tracks back to the Soviet Union, which was established in 1921, which was funded by the government's revenues. Later on, the Soviet Union collapsed, prompting healthcare financing reforms in 1993. Mongolia has undergone an epidemiological transition, which increased life expectancy and reduced maternal, neonatal, and under-5 mortality rates. And below, this is the graph of Mongolian Dalis. The Dalis unburden of disease of Mongolia. A report by the UN World Health Organization says that alcohol abuse could be Mongolia's biggest stumbling block to the economic and social progress. An award survey carried out by Mongolia's Ministry of Health and WHO found that 22% of Mongolian men and 5% of Mongolian women are dependent on alcohol, which reached 3 times higher than in Europe. Another situation we're going to talk about is hepatitis B and C. A member of the capital city parliament and the owner of the leading private hepatitis clinic and laboratory in Mongolia, hepatologist Days Ambition, says that hepatitis B and C are the two number killers of Mongolian people. Odivoy Batarahan, the president of the Mongolian Association on Study of Liver Diseases, stated that Mongolia loses high percentage of its population to liver cancer and cirrhosis. Hepatocellular carcinoma, also known as HCC, is a type of liver cancer is a significant issue among the Mongolian population. As it turns out, it is the number one causes of death among Mongolian cancer patients. In Mongolia, as to be described later, the main risk factors for this disease are directly connected to hepatitis B and C infection.
Okay, talking about hepatitis B and C viruses among Mongolian population. Hepatitis B and C are viruses that affect our liver and can cause acute changes in hepatocytes. It is crucial to understand and interrelate these pathologies with hepatocellular carcinoma, which is type of liver cancer. They will be touched as a separate topic in our presentation. Abbreviations we're going to use is HBV, hepatitis B virus, HCV, hepatitis C virus, etc. So hepatitis C virus among Mongolian population. HCV in Mongolia turned to show a significant prevalence. According to research performed in 2017, 17% of tested people were diagnosed with HCV. Mongolia has the highest burden of HCV and hepatocellular carcinoma in the whole world. HCV spread in Mongolia usually related to long-lasting epidemics due to iatrogenic transmissions through mass vaccination programs such as smallpox, polio, etc. Of course, blood transfusion and extensive use of injective treatment. Iatrogenic, it's a statement which says that it's a result of medical interventions or healthcare practices. Talking about HBV or hepatitis B virus among Mongolian population, and HBV in Mongolia as well as HCV showed a high prevalence. According to the research performed in 2022, 15% of tested people were diagnosed with HBV. Compared to HCV, HBV has smaller prevalence, but taking into account availability of the vaccine since 1991, it is a crucial number of infected people among Mongolian population. So, of course, there was some interventions performed not only in Mongolia, but globally. For example, in 1990, disposable syringes usage is mandatory, reduced the prevalence of hepatitis C not only in Mongolia, but all around the world. 1991 was a good invention because Ratombivax, hepatitis B vaccine invention, in Mongolia, hepatitis B vaccine is included in child immunization programs, which is very important. As hepatitis B and C can be attributed to sexually transmitted diseases, it is crucial to take control over this problem too. J. Shrapke, as others, conducted an investigations among Mongolian people to find out a prevalence of sexually transmitted diseases in the capital and in the same time biggest city in Mongolia, Ulaanbaatar. Among 260 patients, prevalence of such diseases was around 31.1%. Actions that will reduce the chance of sexually transmitted HBV and HCV. Of course, it's education and awareness of populations. Of course, healthcare services, condom distribution, screening programs, vaccination programs. But the most important is collaborations with non-governmental organizations and governmental organizations and international health agencies as well. Policy development, like governments may develop and enforce policies that support STD prevention and control. The most crucial and important, in the last 5 years, Mongolian government budgeted approximately 51,000 for viral hepatitis treatment, which is really small amount of money.
Alcohol is a psychoactive substance with a dependence producing properties has been widely used in many cultures for centuries. The harmful use of alcohol caused a high burden of disease and had significant and social and economical consequences. It's a World Health Organization definition. One of the most significant problems in Mongolia is alcoholism. Probably half of the all older population suffer from the extensive consumption of alcohol. Probably 70% of all participants between the 15 to 19 had ever tried the alcohol. Also, 30% of the group aged between the 20 to 24 regularly consumed alcohol. I want to mention the World Health Organization norms of consuming alcohol per person is 6.2 liters per year, but in Mongolia, this number is more bigger. It's 8.2. Also, alcohol contributes to risk of the developing liver cirrhosis. The Minister of Health of Mongolia created some rules to reducing these numbers. They changed the age of the sale of alcohol from 18 to 21. The rules of consumption alcohol for persons under 21 have been tightened. Also, all stages are tracked between the imported to consumer. License to sell alcohol decreased from the 10 to 5. Also, in 2007, they have spent $250,000 against alcoholism. But in my opinion, if I became the Minister of Health in Mongolia, I will add some points, providing information about dangers of alcohol, because many people didn't know how the alcohol affect to our body, how the negative effect to our body. Also, prohibition of self-production alcohol, because the self-production alcohol is it's less quality alcohol, and it may consist of 90% of pure alcohol per 1 liter. Providing affordable liquidation programs and developing support programs for families affected by alcohol problems. These programs may help many people in this sphere. Also, in my opinion, if the Mongolia create a new job places, it will reduce the poverty. And the poverty, it's the first reason why the people drinking alcohol every day.
Now I'm going to address the public health challenges posed by hepatocellular carcinoma. Starting off with what hepatocellular carcinoma is. Hepatocellular carcinoma is a type of primary liver cancer that originates in hepatocyte, the main cell type in the liver. It is the most common form of liver cancer and accounts for a significant proportion of cancer-related deaths worldwide. Now for the public health issues that Mongolia faces. Like Eugene talked about, the high incidence of hepatitis B and C, coupled with limited vaccination coverage, undercovers the importance of prevention and early detection initiatives. Late-stage diagnosis and limited access to treatment highlights the need of improvement healthcare infrastructure and resources. Now for the interventions. Outline ranging from vaccination program to advanced medical treatment represents a multi-phase strategy to combat HCC. The action taken by the government, such as adoption of the hepatitis prevention, control and elimination program, the funds for subsidies and screening demonstrates a committed and eliminating HCC by 2020. International collaboration, public health initiatives, and partnerships with advisory group contributes to the overall strategy, and emphasis on education on training further strengthens the fight against HCC. Now for the action part. As we move forward, continued efforts in raising public awareness, enhancing healthcare capacity, and leveraging international support will be crucial. The successful implement of these interventions not only serves as a model for Mongolia, but also provides valuable lesson for all other countries in this battle against viral hepatitis and hepatocellular carcinoma. Together with sustained dedication and collaboration, we can make significant strides towards the goal of elimination HCC and reducing the burden of the leverage. Now in the next slide, we have added some of the reference that we have took the information, and thank you for listening.